Hello, my name is Dr. Olivia, and I'm a consultant in the NHS in the UK. And I talk about life as an international medical graduate in the UK. Thanks so much for stopping by today. Happy Easter, happy Sunday. If you're celebrating today, I hope you have a wonderful day with family and friends. It's been a long period of reflection for some people, and it's the beginning of new light, new life. So I hope you all have had a wonderful Lent if you have been celebrating Lent, and that from this Easter Sunday you start off feeling rejuvenated. So today's video is slightly different in that I have been thinking about someone in particular over the past few days and few weeks, and it has weighed a bit heavily on my heart, really thinking about this young lady who came from Nigeria. Her name is Chidima Susie. Forgive me if my pronunciation is off, but she was a young 37-year-old Nigerian lawyer who came to the UK with her husband, and she's got a very young daughter who is still a toddler. And she aimed to further her studies in the UK to give her daughter a better life. And she signed up as a carer, and she started working as a sponsored carer in the UK. And unfortunately, this young lady going to work one day, she felt unwell, but she still went to work, like a lot of us do sometimes. She was prioritizing her dedication to work and her dedication to her client or patient, and went to work to care for this elderly gentleman. And she collapsed at work and she died. Her husband, unfortunately, was at the scene. He called for help, and unfortunately, she was found to have a very severe brain hemorrhage. Okay, I'll touch on this because it's I just slightly want to explain the medical side of what can happen in those situations. It's sometimes very difficult for me to separate the story from the medical bits with my background. But just to explain that a brain bleed, as it were, is commonly called, there can be many different types. There can be bleeds in the layers surrounding the brain to help protect the brain. And people can have those sometimes if they've got an aneurysm. So an aneurysm is something, I'll try to put a picture in. An aneurysm is something where there's a defect in the blood vessel. So it forms like a small balloon or a sac that is weak. And sometimes that can just rupture and cause a bleed. People may not be aware that they've had these aneurysms, or that they have them, because some people may be walking around not knowing that they've got an aneurysm, and that can just rupture at any time. So in some of those cases, there's nothing much that can be done, unfortunately. It's something that just happens, and once people have had a bleed, and then they find out, oh, that was the underlying reason. So that's one of the reasons people can get brain bleeds. And the second thing is from trauma. So if you fall over or an accident, you can have a particular type of bleed on the brain as well, which can be severe depending on how much the brain is affected. And finally, you can have a type of brain bleed within the structure of the brain. And most commonly, that can be caused by hypertension. Okay. Hypertension causes damage to the blood vessels and weakening of the blood vessels, and then you can get a bleed within the structure of the brain itself that kills off the cells in that particular area, which cannot be rejuvenated and can cause stroke-like features, so weakness on another side of the body, problems with your thinking, and in some cases, if it's very severe, death. So the purpose of this video is mainly to talk about taking care of ourselves, taking care of our loved ones, especially seeing that many of us are in an unfamiliar environment where we're working extra hard to ensure that we are not seen as slackers, as it were, to ensure that our dedication to our work is being seen. So some people may sacrifice and continue to sacrifice even more when they're outside of their usual home environment. So this young lady unfortunately had a bleed on the brain, and not sure what type, but just to highlight that hypertension can be one of the reasons, and that many persons of the Afro-Caribbean background have hypertension as part of their family history. We are very prone to hypertension. So it's just a reminder to keep checking on ourselves. And when I say that, I don't mean that we have to become obsessed with numbers and figures and check our blood pressures, 20 times a day, but just being mindful that we are prone to certain medical conditions, and it is worth noticing if there is something different about the way we feel, and if it's a definite change, to get it checked out. So one of the first things I would say is to check out your body. If there is something that is very different from your usual, for example, there's a lump somewhere, or there is significant pain in a particular area that has not been there before, something that is quite unusual, don't ignore it. Right now, there are lots of discussions happening, and people are going more, I think, for medical checkups, especially having heard the news of the King and the Princess of Wales. People are taking things on board to be like, okay, well, I've ignored this for quite some time. Maybe I should go and find out what this may be, or this particular symptom that I've ignored for so many months. Maybe I should look into it. And some people say, well, maybe we're just fueling anxiety. Maybe this is just all a craze, all a phase because of the diagnoses that have come from the palace recently. But I think that we are experts on our body, and we know if something is actually very different from our usual. We know what that feels like, or we know what our body should feel like. Everyday aches and pains, sometimes, dehydration, tiredness, all of these things can creep in. And I'm not saying that every single tiny symptom that may disappear after a few minutes that you need to worry about it. But if something is persistent, something is consistent, something is not usual, please go and check it out. Okay. And thinking about our bodies, yes, always checking out our bodies, but also not forgetting to check out and check in with ourselves when it comes to our mental health. I mentioned in one of my probably very earlier videos about some things that people can struggle with when they first move to the UK. But checking in with ourselves mentally is also extremely important. We might be in a new place and feelings may start to creep in, and sometimes we let it escalate, or we let it snowball into that persistent discomfort, developing into anxiety, depression. And we may think, okay, you know what, I'm just pushing through. We all just push through. I'm not weak. I can do this. But realizing when something is unusual for yourself, similarly to your body, when something is unusual for yourself, mental health wise, to have that checked out as well. So some people may ask me, well, how do you do it? You've been in the UK for many, many years. You've been working in a very busy environment. What tips, what tricks, what advice do you have in terms of checking in with yourself and checking on yourself from both a physical and mental health perspective? One of the things I will say to start off with is that thankfully I'm surrounded at the moment by a lot of colleagues who I admire in many different ways. One of my senior nurses, in fact, I look at her as a role model, and I won't say much more. I won't go into detail because she doesn't know I'm making this YouTube video, but she is a senior nurse with probably over 20 years experience, and some of the things that I see in her, I try to instill in myself as well. And I met her a few years ago, and from then I sort of picked up on some of these traits that I try to incorporate in my daily life, which have definitely helped. So one of the things that she does is she goes around, very busy job, and although it's a very busy environment, she goes about without a spirit of complaining. And that is a tricky one, because somebody might be like, oh, complaining is what brings you betterment in your environment if something is wrong. And I think that a spirit of complaining is different to raising a concern when it is necessary. What do I mean by that? I think that if we go about our daily lives and we get used to, within ourselves and within our environments, speaking in a way that is full of complaints, I think it tends to make it easier for us to have a complaint, if that makes sense. So it's like if you keep complaining, you will always find something new to complain about, because that's what your body and mind are used to. Every day you're not sleeping well and you wake up, oh my goodness, I have had a horrible night's sleep. And it's almost like you automatically will put yourself in that environment to be in a position where in the morning you wake up again and you say, oh God, I had a horrible night's sleep. Or I have so much work to do. I always have so much work to do. And it becomes a habit when you say that. I always have so much work to do. I have so many things to do, that automatically around you, it creates an environment where subconsciously that you allow, or you are part of a situation where there's always like too much to do, instead of creating an environment where you start to minimize or reduce the thing that you're complaining about, so that you are able to stop complaining about it. I don't know if it makes sense. Coming off of that as well, I think that expressing gratitude, or finding a way to see, to acknowledge and to appreciate the benefits of a particular situation, although sometimes it can be hard, but finding a way to have gratitude within a situation such as work or everyday life is important, because sometimes we forget that some of the things that we have now, some of the things that we wished for so many years ago or so many months ago, and when we do have it, we focus on the fact that those same things that we wanted they've brought us so much stressful events. So some people have prayed for marriage or children or a particular job, or leaving a job or leaving a marriage, or freedom from many things, physical freedom if you're in prison, freedom from toxic relationship, freedom from addiction. And now that we are on the other side, we may not only remember that this is what we wanted at one point, but we may focus on the negatives that are associated with being in this new particular environment. So finding the small things that we can be grateful for, although it may be a difficult environment, helps. And I think the last thing that I have taken from her, I know it sounds strange, it's like, oh, you took all these things from this one person, but I really have, it's the small things that you notice sometimes about people, and it's the way that they make others feel, the way that they make you feel. And they may not say very much. They may be very quiet people, very introverted people, but you get a sense of peace and calm, and justness and fairness out of some people. So the last thing I would say that I have learned from this seniorness is to not unjustly and unkindly criticize yourself and others. There may be things that people may not have done in the way that you would have wanted. And as a senior person, or just as a member of society, trying to highlight something that someone may have done differently, which you may not be pleased about, in a just manner, in a fair manner, while still remaining kind, is very important. So I think these characteristics are things that I try to emulate, and I'm not there myself, but as I continue to move forward, and again with this new hope and new life from this previous season coming into this new season, we try our best to help incorporate good qualities in ourselves. And in terms of the practicalities of how do we do these things, it's great to have qualities that you can identify with, but what are some of the tips that you would use in everyday life to try to be able to check in with and check on yourself, like I say? And one of the things is, I would say, giving yourself a small amount, at least a small amount of reflection time at the end of the day and at the beginning of the day. So at the end of the day, you've had a long day, so many emotions throughout the day, giving yourself a few minutes to relive how you felt, why you felt, what you felt, and then making a plan about maybe how to change particular things that may be beneficial to you. So giving yourself, 5-10 minutes, number one, just to digest the day. Really, you may not have enough time to plan out changes particularly, but just to identify with yourself, what was I feeling today? What was that uncomfortability? What was I really happy about? Just to acknowledge your feelings. And it sounds odd because, talking about feelings and timings when I've got so many things to do, but taking 5-10 minutes before going to bed just to check in with yourself is important. And on waking up, a lot of us run out of the bed, try to get ready. We don't want to be late for work. We try to get as much sleep as possible in the few hours that we can. But slowing it down at the very beginning of your day would help to create a better working environment, living environment. Giving yourself a few minutes, just before you start off with a very hectic day, I think can help to slow things down. And slowing things down helps with both physical and mental health. And slowing things down can be difficult, but sometimes just remembering to reduce that negative biofeedback. And by that I mean we're walking very quickly. We're almost running sometimes during our day. Our bodies are tense, our faces are tense. And even while you're watching this, you may be a bit tense. So just to check in with yourself at this moment, relax your facial muscles. Relax your shoulders a bit. Let it come down. Take a deep breath in. And out. Sometimes doing that at different points in the day, just checking in with your body during the day. So stopping for a minute and just relaxing your face, relaxing your shoulders, slowing down your walking pace just a little bit can help. Because what tends to happen is our bodies are so tense and tight, our facial muscles are all, in a crunched up way, our neck and shoulder muscles are tight, and it reinforces the stressful cycle. It's telling our brain that we are stressed. Our brain then goes back and tell our body that we are stressed and we're keeping the tension in. And that constant chronic level of stress can have so many negative medical implications. And that may be a different video, but a lot of the chronic illnesses that we have in our society, stress would contribute to negative manifestations within ourselves. So doing those small steps within the day can help. Some people find journaling quite helpful. I have not really been a journaling person per se, but that can help with your reflection in the evening or in the morning. Meditation as well, some people find that quite useful. Finding activities that may bring you joy. So this is a good one, because sometimes activities may bring us more stress. Like, we're tired at the end of the day, we want to go home, we want to sleep, we want to get some food into us and start it all over. And if we have to think about planning to go somewhere else after work to get to that place, organize a class or pottery or whatever the extracurricular activity that we're thinking of, that in itself may cause us anxiety and stress, like, oh my goodness, I've got to get to this class by this time, get home. But I think one of the things to think about is trying to identify something that you really, really do enjoy. And it may take a few tries to think about or to experience something that really brings you that feeling of calm and peace. For me, it's my bass guitar, although I haven't gone back to practicing forever, but it brings me that feeling of genuine happiness. And so making time for those activities that bring you that feeling of peace outside of your hectic work life situation. Taking a few minutes, even if it's 20-30 minutes, however much you can spare during the week or on the weekend, to get you that, there's endorphins going, will be helpful. And if Netflix is your thing, Netflix is your thing. It brings you joy. As long as you identify something that is genuinely making you happy and not just a tick box. I've got to do all this extracurricular for university, or to go on a date and tell this person that I'm doing everything in the world, but something that makes you feel peaceful and happy will help. And as we mentioned at the beginning, going to these appointments. So checking in, if you need your eye check, if you need your dental check, if you have your regular GP check. I know that it is stressful nowadays to get those appointments anyway and to get through to your GP. But then you may have to think about other methods. If you're not getting through with one particular way, are you able to save up to do it via a different method? But getting those appointments in to have those physical checkups. Mental checkups, that can also be tricky, okay? Because apart from checking in with ourselves and reflecting on ourselves, it is good to also speak to somebody else. I think especially if there are signs that things are changing within ourselves and we want to make sure that we're on top of not spiraling downwards, getting some help, making that appointment to see or speak to somebody is vital. Sometimes we can speak to a trusted friend or family member. Sometimes I am a little bit concerned about that when it comes to a friend or family member, because sometimes people may not be ready to hear everything that we have to say, and they should have the right to be able to say, at this point in time, I don't know if I really want to talk about something that is so heavy with you right now. And I don't think we should force that on other people. And also, sometimes we may seek out speaking to people who are not really that close to us. So if it's like a co-worker who's relatively new, or your best friend's sister, they may not necessarily be the best person to start talking about your childhood traumatic, situations with off the cuff. But, some people sometimes feel that everybody needs to know about these things and everybody needs to be willing to talk about these things, which is true to a certain extent. People should be aware of ills within society, but it may not be the very right time, or it may not be the right person to speak about those with. Which is why I think that getting somebody neutral, like a pastor or a church leader or a therapist or a doctor, may be the most sensible way to go about it, because number one, they're neutral. Number two, they're being paid to be there. And unfortunately, I do think that therapy is too expensive in general. But the therapists also have to, this is the way that they make their daily living. So they have to have a certain amount that they're paid. But apart from them being neutral, they have the expertise in how to help manage or explore various topics. So I think that booking an appointment with a doctor, therapist, or a senior religious member may be the more ideal situation. But of course, if your friends and family are willing and are there for you, and they don't feel like it's too much for them to take on at the moment, then that's always a great option to have. Some people don't have that option, but it's always a wonderful option. So booking in those sessions as well would be helpful. And if you are not able to booking any of those sessions with anybody neutral, or you don't have friends or family to speak to, and even if you do, I think having sessions with yourself, questioning yourself as part of your journaling, as part of your reflection, is always a good idea. So some of the reflective questions that you can ask yourself can be found, there are loads. If you're Catholic and you go to confession, you can literally Google like confession questions, and you can get hundreds of things to ask yourself, so that it allows you to reflect on yourself and your behavior before going into confession. If you're non-religious, I think you can also take those same questions or similar questions, just as a way of helping with that self-reflection mode. A few of the questions I have found useful. One of them says, in what ways am I avoiding the truth about this situation right now? And that tends to help us open up and explore maybe a complex situation that we don't want to think about or talk about. But asking yourself, in what ways are you really avoiding the honest truth about something, will help you formulate the next steps about what you do about that situation, okay, and how you move forward. In what ways can I appreciate this situation? Again, looking at it from a more positive aspect. What am I grateful for in this moment? What am I grateful for today? What am I grateful for about the situation? What practical steps can be taken to reduce my stress level associated with this situation? Okay, if you spend 10 hours working and you're supposed to be spending 8 hours working, what practical steps, what do you need to do in order to be able to cut down on the number of hours, or cut down on the tasks, or reduce the length of time that you take to do a particular task? So what practical steps can you take to reduce the stress associated with a particular situation? And I'm using all of these questions in a work environment, but of course, all of the advice that I've given today can be applicable to non-work situations, to general life situations, and all these questions and all these tips can be used in a very different environment. I am coming at it from an international medical graduate, being in a hospital background, but you can take it in whichever way that it might be useful for you. So these are just a few of the questions, and you can formulate some more yourself, or you can Google, questions for self-reflection, and incorporate these when on a day that you have off. If you're not able to use your 5 to 10 minute end of the day session to include that level of questioning, you may just use your 5 to 10 minute session just to check in with your emotional self. How was I feeling today? What happened today? Just to recap. So those are some of the things I just wanted to point out. It's Easter Sunday. We're starting off fresh. It's almost like New Year for some people. It's a new season, so we're trying our best to start off the new season on better footing, and we're trying to take better care of ourselves physically and mentally. I didn't go into all the physical tidbits and tips in terms of how to improve physical well-being, but a lot of them we know already. Drink your water, get your sleep, avoid too much salt and sugar, get your exercise in as much as possible. So general tidbits that will help you. If you're pre-diabetic, if you're hypertensive, those things will help keep any chronic medical condition, any condition where stress creates worsening of your symptoms, it will help keep things at bay. So yes, general physical tidbits. Nothing too crazy, nothing that we don't already know. I just wanted to focus on both aspects and maybe more of the mental health aspect as well, because it's so interlinked. And having that holistic approach to ourselves and to others is what would enable our society, I think, to move forward if we all felt better within ourselves, if we all took better care of ourselves and each other. So that's all I wanted to say this Easter Sunday. It's been on my mind for a few days, and I thought, let me get it out there today. I will be back next week. I will be doing another exam video next week. I'll start off with the PLAB 2 exam. So if you're hoping to get some tips about the PLAB 2 exam, I will see you. The next 2 videos will probably be talking a little bit more about the PLAB exam. But for now, I hope you have a wonderful Easter Sunday and a wonderful week ahead. Take care. All my love, Dr. Olivia. Bye.